we never know the love of our parents for us until we have become parents. Our children's health and well-being are so dependent on our commitment to promoting food access and good eating habits at home, at school, and in the community. Taking care of our children's health is so important.
I thought I could ignore it, and I wished it would just go away. It was my ADHD.
And like many kids with ADHD, I didn't outgrow it. One of the issues I had was not being able to focus. I would read and I would reread the same sentence.
You'd read it over and over and over again. And then 5 minutes later, I wouldn't know what I just read. It wasn't sticking with me. It wasn't sinking in. And that, to me,
was really frustrating. As I got older, I was still having that issue.
And that's when I knew I needed to talk to the doctor.
If you were diagnosed with ADHD as a kid, you might still have it. Find out more. Take a quiz at ownyouradhd.com to help recognize the symptoms like inattention, impulsivity, hyperactivity. Then talk with your doctor.
I take responsibility for my ADHD. It's your ADHD. Own it.
Welcome back. The bigger question which I always ask the pediatrician, that they see a range of patients, I mean range between babies to age 21. And definitely probably we hear a lot about some behavioral issues with our kids, and we need to address it. And probably one of the most important subject I am interested in is basically the ADD and ADHD or hyperactive kids, and I'm going to probably increase my knowledge by asking the expert, which is Dr. Hani Haider, who is one of the pediatrician in town, to tell us some more details about this concept. I'm sure you see that and you hear about it every day, because I don't know if it's overdiagnosed or it's reality. Most of the kids, they are having some learning disability. And can you just give us your best assessment for the circumstances which we are talking about?
Sure.
I confused you.
Oh, wait. I did not take my medication today. I'm sorry. Okay.
That's a good one. That's a good one. We can put it there.
I had to go for that. I had to go for that. I'm sorry. Okay.
Okay.
You know, we see kids who have ADHD, Attention Deficit Hyperactivity Disorder. We see kids who have ADD, Attention Deficit Disorder. And what is missing in that diagnosis label is actually the impulsivity. Mm-hmm. Those kids usually have some impulsive behavior that is associated with some of the hyperactivity behavior or the lack of attention behavior.
Can you define that impulsive? I'm sure just to make it as simple to the parents.
Impulsivity is when the kid wants to do something, they want to do it right now. So in a classroom in which the teacher is dealing with 26 kids or 30 kids, you can imagine how horrible it is to deal with an impulsive kid who wants to move from one subject to the other, from one thing to the other. It is these kids think of something and they want to do it now. And if they don't do it now, it becomes more of a behavioral, problem. They are irritable. They want to, do it. They cannot understand why not do it right now. It's my way or the highway, kind of mentality. Combine that with a kid who is unable to focus, for example. Okay, the kids who have ADD, typically they're sweet kids. Very, very sweet kids. They're sitting in the class and they're not paying attention. Now, if the teacher is not good in determining that, these kids could actually fall through the crack, because they're your typical jumpy kids. They may play with their hands a little bit. They may, talk to their friend here and there, because they're not paying attention to what the teacher is saying at all. But typically they are sitting daydreaming, zoning out all the time. Academically, they suffer a lot because these kids don't get the curriculum, the material that the teacher is talking about. They come home, they have no idea what the teacher said. They don't know what homework is. They forget their book in the school. They forget their book on the bus. They forget their book bag. They even with their parents' help. See, the problem with that is when they come home, their parents have to actually do two things. They have to do the schoolwork and they have to do the homework. On top of that, they have to make sure that that homework is going back to the teacher, because a lot of those kids usually leave their book at home as well. So, you know, parents who have ADD kids can relate to what I'm saying right now.
Absolutely.
It is crazy how much more work that would require. Now contrast that to the ADHD, you know, patients, the kids who have attention deficit hyperactivity disorder. Those kids typically are diagnosed a little earlier. By age 4 to 5 years of age, they have signs of it, you know, clearly. They have what we call ants in their pants. They are very creative, by the way, very smart, very sharp kids. They're the creative people of the world, not the horses of the world. They cannot see that a straight line is the fastest way. They have to try it, and they have to roll to see if it's faster, or to run around and see. So it's very challenging to the system, okay? And it's very important to remember that, because a teacher who's teaching a kid who has hyperactivity could actually get something out of that kid if they are going to judge them based on a stiff, you know, a requirement. They may fail. So those people need to be diagnosed at early age. They also need to be dealt with in a little different way, and it requires not only a recognition from the parents. It requires a group recognition. The teacher needs to recognize that. The parents need to recognize that. The physician needs to recognize that. And we need to actually put a program for those kids. For example, an individual, educational plan for those kids that would promote their creativity. It would promote their knowledge. At the same time, not fail them just because they cannot sit, without, moving.
Attention Deficit Hyperactivity Disorder, or ADHD, is a term many of us have probably heard before. But what does it actually mean? Simply put, ADHD is a common behavioral disorder that emerges in children before the age of 7. It can extend into adolescence and even adulthood. ADHD was first identified as a disorder in 1902, and for years doctors believed it was the result of serious brain damage. While that theory has since been proven wrong, the precise causes of ADHD are still unknown. What we do know is that the occurrence of ADHD is closely tied to biological factors such as the size and density of various brain structures and the way chemical reactions take place within the brain. For example, scientists have discovered that children with ADHD often have a smaller cortex, the part of the brain that controls thought and action. This diminished size usually occurs in the area of the cortex known as the frontal lobe. The frontal lobe is an especially important part of the brain, playing a role in many key functions, including impulse control, socialization, reason, and judgment. Experts believe this may help explain why some children with ADHD are more prone to drifting off, making sudden outbursts, or using poor judgment. Other research into ADHD has focused on nerve tissue in different areas of the brain. It appears that in children with ADHD, this nerve tissue is smaller or sometimes thinner than in normal children of the same age. While scientists aren't yet certain as to why, they believe these variations can affect a child's attention and impulse control. In addition to the physical differences in brain structure, many experts believe that people with ADHD, like those with depression, have chemical differences as well. Some studies have shown that children with ADHD have lower amounts of the neurotransmitter dopamine in the brain. Neurotransmitters are chemical messengers that carry information to and from nerve cells. Since dopamine plays a key role in the proper functioning of the cortex, not having enough of it could interfere with cognitive processes such as focusing and attention, the very same processes that people with ADHD struggle with. And though it's still being tested, the so-called dopamine theory seems to be supported by the fact that stimulants, which are often used to treat ADHD symptoms, work by increasing dopamine levels. Scientists still don't know the exact causes of ADHD, but much progress has been made. The more they discover about the roots of the disorder, the better equipped they'll be to develop more effective methods for understanding, diagnosing, and treating this common ailment.
Tell me, what are the steps to diagnose ADD and ADHD? I mean, is it a simple test, or it's done by the pediatrician or by the school? Because that's a big also question we always try to answer.
Recognition, for example, is very, very important. Recognizing some of those symptoms we talked about.
Yep.
A child who's deviating from what a normal child behavior is. I went to a lecture 15, 20 years ago, and the guy who's giving the lecture was saying, if you take a child who is raised in a ranch in Texas, okay, and subject them to the same expectation that you have a child who is raised in a Manhattan apartment, you're going to be rushing too fast to diagnose the child in Manhattan as a hyperactive kid and the guy in Texas as a lazy guy. So it is very important to recognize what is normal for that age group. Also, a lot of parents expect the kids to be perfect, an angel. I mean, a lot of times the concern is there, but the kid is normal. The parents are expecting the kid to be an angel. So once the kid deviates from the normal behavior for these kids, okay,
they should be checked.
Well, they should be checked, and just because you have a hyperactivity doesn't make you have hyperactivity disorder. In order for you to have the label, the disorder, you have to be having the symptoms to meet the criteria, okay, and there's a stiff criteria that's put by the DSM-4. And the diagnosis is made either by the pediatrician or better by a psychologist who would actually do what we call multifactorial testing, which will test for learning disability, IQ, behavioral, anxiety, depression, and ADHD.
So in your opinion, is it enough? I mean, like you're suggesting that if it's done by a psychiatric for the above factor, I mean, because it's a full evaluation. Absolutely. Is it better to have it done, always send our kids for that evaluation by psychiatric, or not necessarily?
When it is available, there is no question. Multifactorial testing is the way to go, okay? Because some of those diseases mimic each other, and also there is what we call comorbidities. And comorbidities is basically when you have a child who has an ADD symptoms, but also have a little anxiety on top of it. And I'm scared of bugs. I'm really horrified of bugs, especially flying big roaches. And I always tell my patients, if I am sitting here to conduct this interview with my friend Ameer, and there's a flying roach in the corner of that ceiling and moving their wings, how much attention am I going to be able to do to this? My anxiety is going to make me look like I have the worst ADD. So it is important to diagnose the disorder, and also to eliminate the other possibilities that could look like ADD. Also, it is very, very critical to know that just because you are a little hyper doesn't mean that you have the disease, because you need to have performance effect. So if you have a child who seems to have a little bit of, doze off a little bit, I mean, who doesn't? I mean, who doesn't remember? I mean, I remember, every once in a while I would doze off and catch up. Now, if you're not doing bad at school, okay, if you're doing okay socially, if you're doing okay safety-wise, okay, then you don't have the disease. You may have a trait. It's like anxiety.
Sure.
Well, most of the successful people have some anxiety. Otherwise, you're not going to wake up to work. You know? So in order for you to be successful, you're probably going to be a little anxious about your performance.
Sure.
Now, if your performance is affected by your anxiety, that is a negative anxiety, and that's when we worry about it.
But the bigger question really, which is when we are talking about overdiagnose.
Right.
And I want you to highlight that issue. Is it done because of the professional overdiagnosis, or because our expectation that all of us, we have perfect kids and they should have always the A+ scores, and if they don't get it, we always find an excuse for them, and that's why we want to believe that they have the ADD or hyperactive disorder.
I mean, I have great kids. I have perfect kids.
That's the normal father.
Hopefully they can hear that. Maybe they'll believe it. Okay?
Maybe.
But absolutely, Ameer. You know, we love to have the best for our kids. There's no question. Is there a push sometimes to blame, you know, our kids' failure on something?
Yeah.
Well, sure. But in my opinion, in my experience, I think ADHD and ADD are overdiagnosed and underdiagnosed.
Okay.
And I don't mean to say that to be wishy-washy, but I think it all depends on the practice setting you're in, the group of people you're dealing with. There are a lot of people who want to push the ADHD diagnosis. There's no question. There are a lot of people who do not want to have that label. And you know, it's funny because I can tell you, I have a lot of patients who were recognized by their teachers, recognized by the family members, recognized by, you know, the physician, and yet they do not want that label and they don't want that diagnosis. Wow. And unfortunately, it's a taboo. You know, people think that just because you have ADHD, then you're going to be a failure, or we'll whip it out of their system. You know, we'll get them better. Well, okay, can you convince me not to sneeze if I have allergy attack? Okay, it's the same exact concept. You cannot tell a kid who cannot pay attention or scare him into it. Sure. Okay, it's just not going to work. Absolutely. There are mild cases and there are moderate cases and there are severe cases, and there's no question sometimes our search for perfectionism may take a kid who has mild case of ADD and maybe overdiagnose him and put him on medication. The key, you know, word here is improvement.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
A lot of people choose salad for a low-calorie, low-fat meal. This salad is 450 calories, and the dressing can add up to 100 calories. A grilled 7-ounce chicken sandwich has 350 calories. You could add a kid-sized fry and still have less calories and fat than that salad. Choose wisely, because I don't want you to end up here. Remember, time waits for no one.
Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common behavioral disorders in children. In this chapter, you'll learn how to recognize the symptoms of ADHD and what criteria your doctor may use to diagnose it. The National Institute of Mental Health estimates that 2 million children in the United States have ADHD. But the disorder can be found in adults as well.
It's a disorder that starts in childhood and often continues. It can be diagnosed at any age, but the criteria specify that you have to have symptoms of ADHD as a child, actually before age 7.
So what is ADHD, and how is it diagnosed? Like most behavioral disorders, there is no objective medical test, such as blood analysis or a brain scan, that can be used to determine if a child has ADHD. Instead, a diagnosis is made based on a child's behavior and whether it matches any of the textbook symptoms of ADHD. There are 3 types of ADHD: hyperactive impulsive, inattentive, and combined. Children with hyperactive impulsive ADHD frequently fidget or squirm and can't play quietly. Those with inattentive ADHD are unable to pay attention to detail and have difficulty following instructions.
If you meet criteria for both, then you have what's called combined type, which would be the classical ADHD.
The majority of children diagnosed with ADHD have combined type symptoms. One of the greatest challenges in making a diagnosis of ADHD is that many of the symptoms are actually normal behavior for most children at one time or another. But for kids with ADHD, the symptoms are so excessive and long-term that they impair learning and stunt the development of social skills.
Everyone has inattention from time to time, so they have to have symptoms that are severe, more severe than the normal person in that situation.
If a parent has a concern, a question, if they think their child might be ADHD or have a learning disability, please seek professional help.
A variety of healthcare professionals are qualified to diagnose ADHD. First, a family doctor or pediatrician will examine the child to rule out any physical conditions that might be causing the symptoms.
So I'm going to take your blood pressure, you know, it doesn't hurt.
Next, the doctor or another healthcare professional will talk to the child's family and teachers to find out what symptoms the child has.
He was having a lot of problems on the bus, and he was having...
If those symptoms fall within the range of ADHD, the doctor then has to determine whether the behaviors meet the other requirements for diagnosis. First, the symptoms must have been present before the age of 7 and lasted for at least 6 months. And second, the symptoms must have significantly impaired the child's life in at least 2 separate settings.
The reason that we look for a problem in more than one area is because there is no medical test for ADHD. What you don't want to do is make a diagnosis of ADHD in a situation where there's just one particularly strict teacher, or a child maybe who's dyslexic, so has trouble in reading class but would be okay on the playground or somewhere else.
The final step in diagnosing ADHD is to eliminate other mental disorders such as anxiety, schizophrenia, or a personality disorder as the cause of the ADHD symptoms. Because ADHD commonly coexists with other conditions, such as learning disabilities and depression, it's important to examine a child for those as well.
Kids who have ADHD and learning disabilities, probably the same things cause both of them, only in slightly different parts of the brain. So it's not surprising you would see them together.
If you suspect your child may be suffering from ADHD, it's important to talk to your family doctor and begin seeking help. And remember, there's no reason to feel discouraged or hopeless. A child with ADHD, if diagnosed and treated properly, can go on to lead a productive and happy life.
They're resilient, they're creative, they're artistic, they're musical, they're bright, they're super intelligent, they're fantastic kids. And I tell my parents, please look for the gift in your child. Be positive about something each and every day.
Now, going back to that group which you are talking about, the people who doesn't want to be labeled as ADD or ADHD, at the same time, there is an appropriate treatment for the right diagnosis.
Absolutely.
That appropriate treatment, sometimes the people hear and in the media about the side effect or the major side effect and the future possible addictions and all. Can you highlight us a little bit about that side effect, or really if there is any risk for addiction in the future from these medications or not?
Absolutely. Before I get to that, I just want to make sure that there are alternative therapies for ADHD. Okay? And I always tell my patients, all power to you. Okay? If you're going to stop the sugar and it works, why would I be against that? Absolutely, 100%. If you want to do, different, diet and it works, all power to you. If, why not? I mean, most of the medications are, originally herbs. So, if an herbal medicine works for your child, make sure that, let me know what it is so I wouldn't hurt him with that. But that's okay. I have no problem with that. Also, there is, the counseling. Counseling is extremely important in addition to medication if we choose to do medication. Because the kids who have ADHD, unfortunately, they sometimes throw their hands in the air and say, I give up. I tried so hard. So it is extremely important to make sure that these kids are treated, seeing the psychologist. More important, actually, to have the parents involved in that, because what to expect out of a kid who has ADHD or ADD is different than what to expect from a kid who does not have ADHD. Absolutely. I mean, imagine this. Imagine a kid who has ADHD. You say, well, go organize your closet. It's just not going to happen. Mm-hmm. It's just not going to happen. Now, a psychologist is going to be able to do a family, therapy, and to tell the parents what to expect on, for those kids, what not to expect, and how to promote success.
Thank you so much. I mean, it's very informative. Saying that, and we didn't go about the over the drug issue or medication and the relationship in the future with possible abuse for these, because these are controlled substance in most of the circumstances. Is there any real effect?
It's quite the opposite. Ameer, it's obvious that kids who do not get treated will actually increase their chance of alcohol and drug abuse. They self-medicate.
I'm glad.
So there is no potential abuse for those cases, and in some instances, with maturity, becomes the ability to control your own disease sometimes. Also with the practice you're in, the way you conduct your business. There are some professions that ADHD is a plus.
Sure.
Okay. If you're in sales, actually, you're mesmerizing. I mean, you probably would sell me a car that I don't need, especially if I have impulsivity. That works both ways. But there are a lot of kids who manage to actually control their symptoms later. They're never going to outgrow their disease, but they're outsmart their disease.
Okay.
So a lot of my patients could actually wean themselves off the medications successfully.
Who take care of those kids after age 21 when you are not taking care of them? I mean, and they still have the ADD, they still have a ADHD. Do we have to go to the family doctor or to their internist? I mean, because it's very important to transfer that care appropriately.
Absolutely. We have a group of psychiatrists in town who will take those patients. Some of the internists in town also would prescribe ADHD medications, and some of the family practice doctors would. But there's no question there's enough support for those kids when they outgrow us.
And I hope the program for the last 2 episodes was able to provide some informative ideas and suggestion and management and treatment to be the first step. And I would like at the end of this program to thank Dr. Hani Haider, who really did a great job educating all of us about children care from baby age to age 21, and I really appreciate it, Hani.
I'm honored. Thank you for having me.
Thank you so much.
Thank you.